Pandemic, the COVID-19 and euthanasia parallel, and the moral dilemma within the medical business. Today, the world is facing a global pandemic known as COVID-19. As more people across the globe become infected with the virus and hospitals struggle to keep up with the influx of patients, it has become abundantly clear that companies have stalled to weigh profits with a civic duty to produce ventilators, and doctors have started determining who will live and who will die when resources start running thin. Unfortunately, this discussion has led to an eerie parallel to euthanasia. According to Merriam-Webster, euthanasia is defined as the act or practice of killing or permitting the death of hopelessly sick or injured individuals in a relatively painless way for reasons of mercy. Furthermore, some COVID-19 patients in the US are asking not to be resuscitated when hospitalized, which adds more implications for doctors in regard to the vice of euthanasia. With this in mind, I will argue the following. 1. In most cases, both active and passive euthanasia are immoral, especially regarding patients with COVID-19. 2. The distribution of necessary medical supplies to COVID-19 patients, such as ventilators, should be based upon the patient's probability to live and the patient's probable benefit, but passive euthanasia should not be a method used for patients who cannot get access to ventilators. 3. Finally, companies such as General Motors inadvertently commit passive euthanasia when they do not act within their capabilities to quickly develop life-saving medical supplies for COVID-19 patients. First, in cases regarding COVID-19, both active and passive euthanasia are immoral. Essentially, active euthanasia is the act of assisting in or directly enabling the death of oneself or of another, whereas passive euthanasia is simply allowing someone to die by withholding certain care. According to philosopher J. Gay Williams, every human being has a natural tendency to maintain its state of living, whereas euthanasia interrupts this natural goal of our bodies. Similarly, the body of a patient infected with COVID-19 is actively fighting the virus to live, so honoring a request not to assist a patient is immoral in these states where physician-assisted suicide is legal. Moreover, from a religious point of view, humans incorrectly play the role of God when they euthanize because it puts the matter into their own hands instead of God's. Therefore, it is the inherent duty of humans and medical professionals not to euthanize actively or passively, but to honor the natural tendencies of the human body. To my next point, the deciding factor in determining which patients get access to ventilators should have a utilitarian approach, and patients without access should not be passively euthanized by hospital staff to fight the virus on their own. First, since there are limited ventilators at the disposal of the healthcare system, those most likely to survive if given access to the ventilators should be first. This creates the greatest good by increasing the number of lives saved. Moreover, James Rachels brings up a point by the AMA that it is the duty of those in the medical field to do everything to help their patients live, so honoring a patient's request for non-resuscitation violates this inherent duty. Finally, it is commonplace to see patients suffer, and medical staff have the job to ease their suffering, which does not include euthanasia, because euthanasia does not comfort, but kills. If medical professionals cannot provide ventilators, they should provide beds and other medical assistance along with the help from other companies to provide maximum assistance to patients rather than euthanasia. This is the most utilitarian approach. Finally, the definition for the capacity of passive euthanasia can be extended to companies such as GM when they stall or refuse to produce ventilators because, without a ventilator, some patients won't survive. First, we must understand that hospitals, as well as companies such as GM, are businesses with the goal to increase shareholder wealth. However, during times of pandemic, it should be the duty of these institutions to provide necessary, life-saving care, or else they are allowing passive euthanasia and immoral deaths. As noted by philosopher Susan M. Wolfe, medical personnel are the ones responsible for saving lives and essentially have an oath to care for their patients to the best of their abilities. However, this role is extended to companies like GM when they are responsible for producing life-saving equipment. Moreover, James Rachels adds that in passive euthanasia, an agent merely lets a patient die. This must be understood by companies who undertake producing ventilators so they can act with morality for the benefit of all. In conclusion, euthanasia is immoral. Those most likely to benefit from ventilators should be prioritized, while others should be given the next best medical care to maintain life, and companies that do not act within their capacity to ease the healthcare systems during the COVID-19 pandemic can commit passive euthanasia. It is the duty of healthcare and those associated to act in the interest of prolonging a long, healthy life, not terminating it.